When COVID initially hit, there was a lot of confusion, I think, all over. Is it going to follow like the previous SARS coronavirus, meaning just limited, and would it really get as far as going to the rest of the world like it has? Treating Mrs. Campher, so I first had an interaction with her in the emergency department. I think we were having quite a few admissions at the time, so she was one of 3 that I was seeing at the time. So when she came in with the profile running through the back of our minds, where you have someone who's a bit older, in their 50s, and then you check whether there's comorbidities. You sort of like build a picture that, oh, it's gonna be a tough one, or is it someone who's younger, it's gonna be an easy one in terms of working through them. So I was a bit anxious in her case.
First few days are a bit of a haze. I don't remember much. I decided I need help, and my daughter took me to the hospital, to a Mediclinic.
It's one lady I was really scared for in terms of going to deal with severe disease.
Well, I was in a bad way. I was very nervous, didn't know what to expect. Everything was strange, and also being alone is not nice. The staff were very good, put me at ease. They explained everything they were doing. So they immediately put me on oxygen and a drip and ECG, because I was battling to breathe and my chest was sore. And I'd also started with nausea and vomiting. So they took me straight through and got the drip started.
Sometimes when patients come in and we do lose them, we get really worried. Are we doing the right thing? Are we being as hardworking as we think we are? Because it's very sad for the team. It demoralizes the whole team when you actually lose a patient. But now that we've gotten to a 1,000 patient, I think we know that we are actually strong enough to keep this whole sort of like thing going in terms of having patients come in, recover, and go home, and actually go back to their family members. So I think it's one landmark that's important for the whole team, and it's important for each and every healthcare worker to actually be proud about and actually feel strong and actually gain that second wind to carry on. You know you're actually doing good for the community, and you know that people are getting better. So people's immune systems are different. The one person who comes in and maybe spends a few days in the hospital, and the one person who comes in and spends a few weeks in the hospital, you don't know where you actually fall in. But when you have a caring team that is part of helping you out and actually going through things with you, you just be patient, and you should just work with the whole team and make sure that you receive the best care that they are affording you. Yes.
Dr. Tusi, he was wonderful, very impressed and so grateful. He also put me at ease all the time.
Okay. The final message to her is that we were grateful she chose Mediclinic to come receive care. We have stretched ourselves and afforded her the best care that we are able to afford. And when it comes to healthcare, it's really a journey. It's something that you start and you keep improving, and you try to get back to normal physiology, to normal lifestyle. For some patients, it doesn't get to 100%, but it's something that you actually have to keep trying. I understand she's not a full 100% yet, but she'll get there. It's a matter of still working with the team on an outpatient basis and make sure that we still strive for the best health for her.
I'd like to thank all the staff for looking after me so nicely.
Yeah, it was a feeling of great relief and a feeling of being a part of a great team, and a feeling of being a contributor to the whole process, because COVID has been very overwhelming for the whole nation and for the healthcare system. So when you get to be taking baby steps and you actually have a landmark and you can actually put a land post and say, wow, this is number 1,000, actually becomes quite great that we are not really taking very small baby steps, we're actually making landmarks. Now we've gotten to the 1,000 patient who has been discharged and well and going home. So it was all those feelings mixed together, and yeah, happiness, I have to say, you actually become happy, you actually give yourself a pat at the back, and all the team members actually become part of something bigger than just dealing with the one patient that they're dealing with at the time. Yes.